Welcome to this local COVID-19 update for Rogers. My name is Teena Avery. Joining me today, we have the Town of Orangeville Fire Chief, Ron Morden. Thank you so much, Chief, for joining us today.
Thank you very much for having me.
How are you today?
Oh, I'm doing great. Had a great weekend. It was a beautiful weekend to be outside and working in the garden, which is a nice relief from the daily chores that we've been going through.
So let's get into it. Let's start talking about COVID-19 and how it has affected the Orangeville Fire Department.
Sure. It's affected the Orangeville Fire Department in a number of different ways. We are familiar with outbreaks like this. We've dealt with SARS in the past and H1N1. So our firefighters are aware of some of these conditions that are out there, and they're familiar with our personal protective equipment that we have to wear. Patients have been screened as far as medical calls. They've been screened for a number of years for respiratory illnesses. So we've been receiving information like that over the years. So when this outbreak came about, we were somewhat prepared with our personal protective equipment. We did have a bit of a stockpile of it in preparation, and which is a great thing. We're lucky enough to protect all of our firefighters. We were originally told to prepare for a 30 to 35% loss in our staff, and that could be affected by COVID-19. And fortunately enough, we've only had 2 firefighters in the first part of this go off work for 14 days just due to travel. And from there on, our firefighters have been healthy. They've been coming to work, and our volunteers have been available and have done a tremendous job.
And I'm assuming you have contingency plans for if by chance, which we're hoping obviously doesn't happen, that COVID-19 does start to affect the firefighters in Orangeville. There's contingency plans for that, I'm assuming?
Yes. We have what we call a mutual aid system with our Dufferin County partners. And actually, it's a seamless system. It travels all across the province. And so many a times you'll see us at a fire, and you'll hear us comment that, for example, maybe Shelburne and Grand Valley Fire has been in attendance as well. And that can be used for any type of call. So it's not just for requirement of a tanker or a pumper. It can be used for manpower too. So some of our rural municipalities are sometimes shorthanded, and they put out the call, and we will respond and assist them. They will call us, and we will. It just works vice versa. And same thing would happen if a fire department was found that they have a decreased number of firefighters available, that we could call upon these other departments to help us out.
Wonderful. And has there been a decrease in the emergency calls since all of this happened?
Yes, actually, we've seen a decrease. I guess I would put it down to there's not as many commuters on the road. So the traffic on the road, we haven't seen very many car accidents. I possibly, with our medical calls, they are down as well. And maybe that's attributed to some people not wanting to go up to the emerge. However, it is highly stressed that if you are experiencing a life-threatening emergency or chest pain or shortness of breath, that you do call 911 for that assistance, and then don't delay that. But that could account for some of the decrease in calls too. So it's overall, it's been very good.
Well, I think it's definitely top of mind for people with regards to how they're feeling, and everybody's very aware of how they're feeling and kind of monitoring themselves, just because I think it makes everybody anxious and a little bit stressed out. So that could be a very big part of it too, is people are just, only calling for the absolute emergencies.
Exactly. Yes.
Yeah. Yeah, for sure. I know you mentioned that you did have a stockpile of PPE equipment. Is that something that you still require as time is passing?
We're not sure how long this will go on for. And I believe that PPE, our personal protective equipment, as far as masks and gloves, that's just going to be part of our norm as far as responding to incidents. And we are going to have to continue a stockpile. Right now, the province has set up, I believe, a stockpile where we are providing them an inventory list once a week. And once they see that our supplies are going to be depleted, as far as I know, again, we haven't had to make application for that. As far as I know, they will assist in the replenishing of that equipment. So as far as the Orangeville Fire Department goes, our PPE is fairly well stocked.
Wonderful. And I'm just going to throw it out there in the middle of our interview that we thank you for all that you do and for taking the time to speak with us today and everything that you're doing within the community. I know we've seen videos of the drive-by to thank the frontline workers at the hospital, which I think is absolutely phenomenal. But we all want to thank you, the fire department, the volunteers, everybody involved as well, for doing what you do, but under even more stress than what you did prior to this.
Right.
And speaking about stress, I mean, this is already considered a very high stressful position, a firefighter or being a member of the fire department. So with all this increase of stress and anxiety, what are firefighters doing to stay positive?
Well, we our full-time crews that are at the station every day. We have quite an extensive physical fitness program here. It's a strenuous job. It's very demanding, and we require fit firefighters to be able to function in any situation that's given to them. So that's a great part right there, is just that physical fitness portion, and many of them eat well. I'm quite surprised what they can put into a blender and drink. But you know, they are very conscious of their health and their weight and their diet. And so that is really good. For all of our firefighters, we have through the town of Orangeville, we have the EAP program, which is an employee assistance program, that if they're struggling in any way, be it from COVID-19, financial, family issues, things like that, this coverage is there for them and help them in a time when they may need it. So that's a great advantage that the town of Orangeville offers to our firefighters.
Wonderful. So the weather's starting to get nice. We just recently had a few nice sunny days. And people are going to start to talk about having fire permits and what they can do in their backyard. Or, of course, we're still encouraging people to remain within their own family unit and isolate as a family. So are fire permits still available, and how do people go about getting one?
Yes, fire permits are available. Some municipalities have chosen to put fire bans in place, and cooperatively through the County of Dufferin, all chiefs decided not to implement the fire ban, as during this time when people are home and they're not able to get out and enjoy the trails and get out shopping, restaurants and things like that. That was one of the things that we didn't want to take away from families, that they could still go out into their own backyards, have a nice fire, and tell some nice stories and enjoy the company outside, still recognizing social distancing. But fire permits are required in the town of Orangeville, and they can be found on the town of Orangeville website. And the bylaw is there, and they can fill out the fire permit online and submit it. And as long as they are following the bylaw and keeping safe, we encourage that family fun.
Absolutely. It's an opportune time to get to know your neighbors as well, as they probably have a fire in their backyard, and keeping away from the physical, or staying in the regard of physical distancing, talking to everybody over the fence and just remaining far back enough It's a wonderful thing. So for
That's
sure.
right.
And I mean, what can the community and the residents do while they are at home with regards to fire safety?
Oh, with fire safety. Okay. Well, it's a great opportunity right now for while people are home with their children. Maybe mothers and fathers have moved in with them, but is to practice their home escape plan. And everybody can sit down at the dining room table and go through that plan, design it, push your smoke alarms and test for the alarm, make it sound. Everybody could maybe be in their bedrooms, crawl out and go outside to your meeting area to make sure that everybody gets out safely. So they can practice that. They can practice stop, drop, and roll with the children, and they can go around and check all your smoke alarms and your carbon monoxide alarms to make sure they're functioning properly. So everybody is safe to help us, that we don't have to attend for an emergency.
Wonderful. And I mean, that's great advice. This is the perfect time to be doing it as we're spending more family time at home and reaching out. And you know what? Remind your neighbor to do it as well. I mean, when you're texting or having a Zoom meeting or whatever you happen to do, this is the time to definitely do that. Exactly. So we've got about a minute left, Chief, and I'm just wondering what you do to de-stress and stay sane in these crazy times that we're having now that are probably very, very busy for you.
Yes, no, it is very busy, but I'm not like anybody else. I'm separated from my children and my grandchildren and things like that, so that's stressful. But having a great wife to go home and talk to and have some nice dinners, and again with the nice weather, getting outside and working in the garden, that does a world of good to a person being out in that sunshine. I have to say that.
Absolutely. Well, I want to thank you so much for joining us today. And please, if you have any updates, please do come back on and let us know all about it.
I will. Thank you very much. I appreciate it.
All of you out there, stay safe and healthy. We'll talk to you soon.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
On the next episode of Cinema Scene, Curse Films writer-director Jade Shield discusses the insightful 5-part documentary series on movies like The Exorcist, The Omen, and Poltergeist, now streaming on Shudder. Check it out.
How many current patients are suffering from COVID-19 that are at Headwaters right now?
Perfect. So currently the total number that we have is 4 that are admitted in the hospital. The total numbers that we have admitted in general since the beginning of COVID is 17. Around 1/3 of these patients were critical and required to go to the ICU. And we have discharged all of them except for 4 that are still with us. And we had only 1 death so far.
Okay. So recently there was an announcement made that the outbreak at Headwaters was declared over. So can you tell us what this means and can it happen again?
Of course. Teena, we had for around a month or like around 4 weeks, we had an outbreak on one of our units, which is the F wing. This is our medical unit, and it's also the telemetry unit. We have 30 beds there, and the outbreak started on the F wing. We worked with public health, and we worked with our infection control team to contain the outbreak. We closed the unit for admissions, and we stayed closed for admissions, meeting every day with public health, our infection control team, to make sure that we are doing all the measures necessary to stay on top of controlling this outbreak. We stayed around 4 weeks. We had some staff and few patients on the unit, and our census became lower and lower and lower because we were close to admissions. A few days ago, on the 27th, we declared that the outbreak was over on the upwing. And what that means for the public is that we're back to admitting patients on the upwing. We're able to provide the service that they need. During that time, we couldn't admit on the upwing the telemetry or cardiac patients that require cardiac monitoring. But we worked with our biomedical engineering department, and we came with creative ideas on how to remotely monitor them. We put them on the surgical wing, and we were monitoring them from our monitors on the ICU. So we had to come up with creative alternatives to make sure that we are monitoring our patients and providing the services required, but at the same time protecting the public, protecting our staff and the patients that we had on upwing. So what it means is that we're back open to business, is that we don't have any outbreaks. We have 2 cases that are left in the upwing, and we are doing all the measures possible to keep protecting them and protecting the staff, using our proper PPE, our proper hand washing, and making sure that we are doing any steps necessary to prevent any further outbreak. Can it happen again? It's possible. That there's no way that we can predict it cannot happen. But what we can do is be very diligent, be very careful, and do everything necessary, everything within our means to make sure it doesn't happen.
Wonderful. And as a community, all of our residents, what we can do is follow the rules. Remember to stay at home, keep the physical distancing, keep following the rules as best we can, so that we can stop the number of cases that have to come to the hospital, which prevents, which kind of in turn works together, which is a wonderful thing. But we have to make sure that we're not doing that. And when we see the nice weather, that we're not just becoming complacent and deciding that we should go. Absolutely.
We keep
Sorry, go ahead.
We keep discouraging the public from visiting the hospital. We have limited our number of visitors for only like extreme cases. We have provided the tablets, iPads for our patients to be able to Zoom or on Facebook or teleconference with their loved ones. So we're doing some virtual visits to keep our community connected with their loved ones in the hospital. But as you said, the community has the biggest part to play in preventing and stopping the spread of this infection.
Well, I commend you on the use of the technology to help patients, because I think a lot of times for a patient, it's important to see your loved ones. And yet, while we totally understand why we can't right now, just being able to have that communication, even if it is via Zoom, via Skype, whatever it happens to be, can do a lot to make a patient feel better and the family feel better as well.
Yes.
So can you tell me a little bit about your position and what you do?
So my position is I'm the patient care manager for the ICU step-down unit, the medicine and telemetry unit. I'm also the manager of the transport team and the float board.
Okay. And can you give us a picture of what it's like on the front lines? I mean, as a community, we're also very thankful for everything that absolutely everyone that works at Headwaters Healthcare is doing for us. But what's it like on the front lines, be it, let's say, in the F-wing department? What's a day like?
So just to the public, the front line is not only nurses and doctors, it's housekeepers. They do an amazing job and they do tremendous amount of work. It's lab technicians, it's the pharmacy, it's our kitchen, our dietary aides, our rehab team. It's everyone that I might not mention everyone, but it's everyone that's involved in the patient care from A to Z. We all work together collaboratively to provide high quality patient-centered care. And that's what we come here for every day. How it would be like on the front line with the nurses and the doctors and everyone else is challenging. It's coming that there's some uncertainty with COVID-19. We had multiple outbreaks before, for example, with the influenza, but things were more concrete. There was more knowledge about the influenza, how to deal with the influenza, how to prevent the influenza. But with COVID-19, there's still a lot of things that we are discovering. There's a lot of uncertainty. That's creating some kind of fear or probably stress, but they come every day, they roll up their sleeves, they come with a positive attitude, with a smile on their face, and they are very committed to provide the service that they provide to the community. When you come to the front line, and I wish you could visit and see, but when you come to the front line and see, they're very positive. They're maintaining the distance, but they're laughing about it. They are working together very well, and they are overcoming their stress by being a family, dealing together with this as a family, and that's how we can go through this.
Wonderful. So what types of things, I mean, you did mention that they're staying very positive, but is there anything else they're doing to remain positive as a unit, as a whole at Headwaters?
Yes. So as Headwaters, as an organization, our values are kindness, passion, teamwork, and courage. And that's exactly what we need to stay positive. If we are living every day our values. You see the staff coming here with all the courage they have, and they work together as a team, as a family, with a passion to provide the care that they need. Things that they do together is that they stay in contact with each other. They have Facebook groups to talk to each other. If one of the staff is sick, others are passing by, leaving them things on their front porch. They communicate together all the time. They support each other very well. And if any nurse or any PSW is going to a patient's room, everyone is outside waiting for them to support them. So the way they work together is amazing. The way that they support each other. I think supporting each other, staying positive, staying in contact with their families. I have some of my staff that chose to have trailers in their front, in their driveway, and they stay in their trailers and they FaceTime with their families. So there's a lot of things that the staff are doing very creatively to stay positive and to stay strong and to stay able to come every day to do their job.
Wonderful. And we're thankful for all that they do to definitely do that. And let's talk about the stress, because not only do they have the stress of doing their job on a regular basis, they do have the stress of COVID-19, the stress of wanting to help everyone and still protect their families. So are there protocols in place to help them deal with stress?
To deal with stress itself, we have our HR department, we have our employee joint health and safety committee, we have an employee assistant program that is very confidential, that they can call and talk to someone that can guide them through. And we also have their managers, they have their frontline leadership that is always connecting with the staff and making sure that we are helping them with this stressful time. What they staff themselves do is that, as I said, they stay in contact with anything that will help them. They are following the hospital protocols. We have some protocols in place to protect the staff and to prevent the spread of infection from the hospital outside. So, for example, at the moment they come to the door, we are screening staff. We are checking if they have any travel history, if they have been exposed, if they have any of the symptoms. And if anyone shows any of the symptoms, they are not allowed into the building. They go to the testing center. Staff that are cleared at the doors will receive a face mask, will do their proper hand hygiene, and then they go to the building. We are providing them with the PPE as required and when it's required. We are also doing enhanced cleaning on the units. Staff are coming with their civilian clothes and they change to scrubs and then they change again before they go home. Staff are encouraged to self-monitor, so they're checking their temperature twice a day, every day before they come and when they leave, to make sure that we are trying to prevent anything coming from the community to us, and at the same time, we're trying to protect the community of what's in the hospital.
Wonderful. Is there still a large need for the personal protective equipment, the PPE?
There is a need for PPE across Ontario for all the hospitals, I'm sure, and I'm sure they all have the same challenges. The need is for gowns, is for N95 masks specifically, for also surgical loop masks. So there's multiple needs for PPE. The community has done great work in providing support to us with PPE, with some donations. And also they have done a lot of work from our local businesses supporting us with that. Our foundation also has been raising some funds for that specifically, but there is huge need for PPE. It's a matter of sustainability on how we have what we need for now, but we don't know how long this will stay. And we need to make sure that we are able to sustain the level of protection and the level of due diligence we're doing now throughout the period of COVID-19.
And you briefly mentioned there, but let's talk about how amazing the community has been. I know I say it on a regular basis that we live in a wonderful community, but something like this, a crisis like this, brings us together. And you happen to mention just some of the ways, maybe there are a few more, of how the community is supporting Headwaters.
I think the most appreciated that our staff and the frontline staff have felt is the amount of support they're getting from the community. Our hospital is a medium-sized community hospital, and you really feel the feel of the family in the hospital and outside. So when our staff go home, their neighbors are like banging on their pots for them or clapping for them. They come the next day with a smile on their face, feeling that they're making a difference. We're having the firefighters and the police officers coming with their sirens to the hospital just to encourage the staff for what they're doing. And these small gestures make a lot of difference in the staff morale. But at the same time, the community in general has done an amazing job in supporting the hospital. We had a lot of donations of PPE, masks. We have a lot of people that have 3D printers have been creatively printing the face shields for the staff so they can use like 3D face shields. And this has been amazingly helpful for the staff dealing with the COVID-19 patients. We had a lot of donations from the school boards, from gloves. We had a lot of donations of gowns, some N95 masks. So multiple businesses, local businesses have supported us. Also, multiple local restaurants has been amazingly providing the staff with around-the-clock food. We even received donations of running shoes for the staff, so they're comfortable doing what they do. It's a lot of hours working and standing and running around. So the community has been very supportive. Our foundation has created a fund that's established for supporting COVID-19 during this period. They have raised around $675 in monetary value, which is amazing. It's been used to purchase PPE, but also other urgent needs for the hospital that's needed during this time. So there's a lot of support to the foundation, and the foundation has created a link just for COVID-19 support, and it's on our website, it's posted on our website. And they keep updating the community on what has been purchased and what our needs are. So the community is very involved with our foundation and communications department.
That is absolutely phenomenal. So for more information, please go to the website and find out what they are in need of, for sure. So we've got about half a minute left, and I just wanted to ask you what you are doing to stay sane when you're not actually working very hard at the hospital. Do you, on that, hopefully the little bits of time off that you are getting?
Yeah, so I think we're working very hard. Everyone in the hospital is working hard. We're working longer than the hours that are required. And once we go home, you're still on your phone, still following with your email, making sure that everything is still, the operational plan that we created is still going through. I think for me personally, it's dog therapy. I stay with my puppy when I go home. She's like jumping, sitting on my lap. And this is the best thing that has been de-stressing me and keeping me strong for every day.
Wednesdays at 7:30 p.m., it's the RTV quiz. Giovanni Petiti hosts a weekly trivia competition that lets you play from the comfort of your couch. Play along at home and challenge your friends. And don't forget to follow along on social media. Let us know who's top of trivia, and you can find yourself featured on a future episode.
Are you kidding me, folks?
The RTV quiz, Wednesday nights at 7:30 p.m. on Rogers TV or at rogerstv.com/RTV quiz.
The economic impact of COVID-19 has drastically affected food banks across Canada. Many only have enough food for the next 2 weeks. But when you donate to Food Banks Canada, every dollar can be stretched further to help our fellow Canadians, your neighbors who are in need. It's time to step up to the plate and donate. Please give what you can at foodbankscanada.ca.
I am thrilled to introduce our next guest, Althea Casamento from Choices Youth Shelter. Thank you so much for joining us.
Thanks, Teena, for having me.
So let's start off by talking about the services that Choices normally offers pre-COVID-19. What type of services do you have available?
Well, yeah, definitely. We are a emergency youth shelter. for all of Dufferin County. We serve residents in the area, ages 16 to 24. We provide safe housing for them, so in the form of a shelter, of course, and food and necessary services, laundry, programming, counseling. They have a caseworker that works with them to formulate goals, short-term and long-term goals for them. We also find them any sort of necessary appointments that they need. So for example, if they need counseling appointments, so we usually use DCAF or FTP or any other services. And for doctor's appointments, so we find out, do they have a doctor? When was the last time they saw a doctor? Do they need medical attention? Any of those things. And we try and work with them for that. In terms of programming, so we have something called the Independent Living Program. The idea behind it is when they come to us, they're in crisis. So we spent the first 2 weeks getting them out of crisis and, getting their anxiety under control and getting the necessary services that they need. Then after that, what we do is we sit down with them and we talk to them. Do you want to go back to school? Do you want to get a job? What are your goals here? And we sit and we plan with them what their goals are. We also have a wellness counselor on site, which they are able to participate in one-on-one counseling with our wellness counselor. Her name is Karina. And so they can also benefit from that as well.
Wonderful. So how has COVID-19 affected your services and how you're able to provide them?
It's definitely impacted us as with other, organizations. We have moved from, instead of having the shelter open from 5 p.m. to 9 a.m. the next morning, so we were just overnight, we are now 24/7. So the reasoning behind that is we wanted to provide a safer environment for the youth in our community, so we can get them off of the streets and out of direct contact, so that they always have a place now that they can stay. So while they're in the shelter, we had to cut some of our programming because, again, with the physical distancing. But some of the other things that we have brought into the shelter is, so we will do movie nights, game nights, pizza days. We've been very fortunate to have some of our community businesses, Rotary, for example, help us out with meals. So they get meals, special meals every Wednesdays, every Fridays. We've had a number of food donations. So another thing that we had implemented with them was one of the programmings was food and nutrition. So we've kind of had to alter that a bit where, of course, we can't have someone come in, but what we've been able to do is our staff will sit with them, we'll go through the nutritional guide, we'll go through what does the label look like? And we have gone online to check for recipes of things that they'd like to make, special recipes. We've made pot roast, we've made a number of things, scalloped potatoes. So we're trying to make it, just homey for them and get that sense of comfort. And because it is, everyone's affected by it. Of course, your anxiety levels are up. It's very, very stressful. So mentally, we're trying to help them to cope. We've already posted a number of hotlines that have come out and workshops that have come out, and we have it on our notice board. So they're getting both, the mental support, mental health support, and the support with our staff is, what do you guys want to do? We understand it's tough for you. You're not used to being inside all the time. What can we do? We've actually started a garden with them too. So we've planted small little plants. So we're keeping them inside. We have a garden box on site in our backyard. So I know that they love doing that. So that's brought them a little bit of joy too. We're just trying. We have resident meetings every week, just to follow up with them and see, okay, is there something that you're needing this week? Do you need extra time? Do you need extra supports? What is it that we're looking at right now? And it's just all to make them a bit more comfortable and make this crisis a little bit more manageable.
Well, that is absolutely phenomenal, and good for you for coming up with all of these ideas.
I got to thank my staff. I have an amazing staff.
Well, we thank all of them as well. So in terms of support, I know because the federal and provincial governments have been out there providing different supports for all these people who have been, lost their job and all that sort of thing. Does Choices Youth Shelter, are you currently receiving support from the provincial or federal government right now?
We're receiving it from the county. We've been in several, conversations with the county, just kind of talking about our needs, and we've partnered up with our other social service partners, and we're assisting each other the best that we can right now.
So please tell us how the community can help you, and how they would go about doing so.
Well, we started a GoFundMe page. The idea behind the page is, just to help us through the crisis. So like, again, with other businesses, these are uncertain times. And of course, a lot of, added expenses that we didn't really cater for, right? And neither did other businesses. But essentially what we need them for is, because we have moved to a 24/7 facility, we now need staffing. So we had to add more to the roster. We had to, it's more in staffing costs. Plus, we had to kind of retrofit our facility to have an isolation/quarantine section. So in, knock on wood, the event that someone does become sick, we have a way to cater for them. We have a way to help them. And that, again, goes with PPE. We needed to get the proper PPE because, as you know, it's now government mandated that we wear a mask at all times when, in the congregate living area. We generally use our gloves. I mean, that's part of what we had to do anyway at the shelter, but now we needed to use it more frequently. We've now needed to buy more cleaning supplies, and time has to be spent cleaning down the shelter, cleaning down every single thing. So, and then there's extra time that has to be put into meal preparations, snack time, picking up grocery items, picking up from the food bank. So these are all added expenses for us, right? So that's what the GoFundMe is designed to cover.
Wonderful. So if you are in the position that you're able to help out Choices Youth Shelter, please go to their GoFundMe page. You can make a donation. You can make it anonymously. You don't have to put your name. You can do whatever you want. But if you are able to, I'm sure it would be greatly appreciated. And tell us, how can people help that may not have the financial means to help you? How can the rest of the community help you if they can?
Well, right now we're taking donations in the form of, if you aren't able to do that financially, if you have any extra cleaning supplies, if you have any, there are a few people who are donating food. So food boxes for the residents, who are donating spa kits, or, just fun things for the residents to have and to do in this time, board games, books. And also we're looking for volunteers, for people to just come into the shelter and just assist us with maybe game time or planting or cleanup of the shelter outside, anything like that. We are open to it.
Wonderful. And with regards to technology and having people connect socially, whether it's for counseling or maybe reaching out to a friend that they haven't seen in quite some time because their situation has changed, do you require any electronic equipment that way that people could donate for those specific purposes?
So what we're looking into is, we don't have, I guess, the fundings right now to buy laptops. So, I mean, that's what we've kind of tried to put a little bit of money aside for, and that's what the GoFundMe is for as well, because we do want to provide the youth with counseling, and that's being done virtually as well, right? So they can phone in or they can do that. We want to have a laptop or an area set up so that they can have their one-on-one. So again, if anyone's able to donate that would be fantastic.
Just out of curiosity, how many people can you house in the house at one time?
Usually it's 20. Right now, we're not at the 20, and we've actually just opened up our Headwaters transitional housing, just so we can accommodate Dufferin County a little bit more and assist with, this crisis and provide the physical distancing.
Well, I think that's phenomenal, and especially if you do have room, because I'm sure there are people that may be out there that don't know where to go, and this is such a stressful time. And speaking about stress, with regards to the people, your employees, and everyone who works there, this is an added stress on them and added hours and all that sort of thing. Are there procedures in place to help them deal with the stress of doing this?
Yes, actually DCAF has come out with supports for frontline. So I've actually provided all of my staff with that information so that they can call in and speak and, take care of their anxieties and their stresses. And I'm always encouraging them, in your time off, do something for you. Spend some time with your family if you can. Spend some time doing something that you've always wanted to do. And then I consider us a really strong team here. We're able to just kind of bounce information off of each other. And if we notice that one is having a tough day, we do have a fairly open relationship here where we are able to talk to each other and say, hey, I noticed you're having a tough day. You want to talk about it? You want to, if you want to talk one-on-one or in a group setting, it's completely open. And I try to have staff meetings once a week so that we talked about any issues that are happening in the shelter or anyone facing any challenges or anyone needing extra support, just so we work well as a team and we know each of these individuals as a team is working okay.
Wonderful. So let's talk about what is it you're doing right now to stay sane in this crazy time, other than working a little bit harder and being a little bit more stressed. What are you doing to stay sane?
Me personally, or me as choices?
Yeah, no, you personally.
Me personally, well, that's a great question. I spent the weekend just, reading a book and taking some photos, gardening. They're sort of some of my tools that I use to just kind of decompress and reset myself and use for reflection as well.
Yeah, no, that's wonderful. There's so many different things that people can do to, and doing what you love to do is kind of, I guess, the biggest stress reliever for sure. So we've got about 30 seconds. Tell us a little bit more about you. How long have you worked with Choices?
I've been here since June 2019. I've got to say, it's a fantastic role. It is very challenging, don't get me wrong, but it's very rewarding and very fulfilling. I don't see myself anywhere else. I mean, I love growing in this position. I'm learning every day. And again, I have a fantastic staff with very diverse backgrounds. So we're able to bounce ideas off of each other and learn from each other. So I think it's a fantastic role.
Hi, have you heard there's a new fitness show on Rogers TV? It's called Move with Melinda. That's me. I'll be bringing some professionals on with me to talk about why exercise is so good for our mind and our body. And also, I'm going to be giving you some fitness routines you can do at home. I'll be there. Will you?
It was John's graduation. We were so proud. We all got together for a picnic. That's when we heard coming from the radio. So we stopped and we listened. It helped us get to safety. That's why when I think of John, because now he has a real future to look forward to.
Welcome to this COVID-19 update for Rogers. My name is Teena Avery. Joining me today, someone who takes care of my favorite creatures on the earth, Callie Millman from the Ontario SPCA and Humane Society. You're the Community Development and Media Relations Specialist. Is that correct?
I am, Teena. Nice to see you.
It's good to see you. Thank you so much for joining us today. So how are you doing?
Doing quite well. I think as most people, or I should say a lot of people can understand, it's a bit of a transition, working from home. Still been quite busy. But no complaints for sure.
So let's talk about the Ontario SPCAs. Are you still able to adopt a pet? How has COVID-19 affected what you're doing in your operations?
So the Ontario SPCA has 12 animal centers across Ontario. Of course, many of the viewers would maybe be more familiar with our Orangeville Centre, which is one of our 12. And right now for COVID-19, we are closed to the public. And it's really important to us that we do that because we know that people should be staying home so that we can keep our community members safe. We're encouraging everybody to stay home, and therefore we have decided to close our doors at this time. And therefore, we're not adopting out or fostering out either.
Okay, actually, well, I was going to ask you about fostering as well, but let's talk about, I know you're not doing it right now, but what is the fostering program? How does that work?
So, as you can imagine, prior to all of this happening, we had foster animals already in foster homes. So they've remained there with their foster families, of course, while we've been closed. And essentially, our program is called a foster to adopt program because in an ideal world, we're hoping that once these, adorable animals are recovered, let's say, sometimes they go into foster because they maybe had a surgery or something of that nature and they need time to recover. And it's much better for them to recover in a home than it is within our centers, So if they go out on foster, we hope that eventually, once they're all healed and they're ready to, sort of go through with the full adoption, that those foster families decide to do that.
Wonderful. So I know in this time we're not able to foster or you're not able to adopt. So what's happening with the animals that are currently in the different SPCA locations?
Yes, and we do. We definitely have animals in our various locations, as you mentioned, and we want to reassure everybody that, there's nothing to worry about. The animals are doing wonderful. Maybe perhaps being close to the public, we actually find that our staff have a little bit more time. They're not needing to process adoptions, process these fosters. There's a lot less going on in that aspect. And therefore, the staff are spending quite a lot of time with the animals, giving them lots of care and enrichment. And, spring is upon us. It is this time of year. The weather's getting nicer. So the dogs are going out for nice long walks. We've got small animals that are receiving really great enrichment in the form of toys. Cats I saw an adorable video from one of our animal centers yesterday, and they put a tablet in the cat room that had fish hulls swimming around, and the cats were playing with it. They thought they were really seeing fish. So, lots of creative things going on to make sure our animals are staying happy and healthy.
That's wonderful. I was actually saying to my husband yesterday that I didn't know my community had so many dogs. That the only way people are getting out is going out and having walks and doing that. And you always see the regulars, and we're always out there walking our dog. But I have to tell you that I didn't know there were so many dogs in our community. Or maybe people are just walking further.
Yeah, and that's it too.
Yeah, for sure. So with regards to donations, because I know that normally, not just the financial donations, but normally there's donations of pet foods and toys and supplies. Are you still able to take those donations during this COVID-19 crisis?
What we're doing is encouraging people to do so online. And so what we have is an Amazon wish list, which is kind of neat. You can find it on our website, ontariospca.ca. And that wish list is quite cool. Basically, you can go on there and you can purchase some of the items that maybe we need, that we have on that wish list. And then Amazon ships them directly to one of the locations, whichever location that you've selected to have those items go to. So again, there's, in the age of technology, the fact that you and I can even have this chat today. There's so many creative ways that you can still help without having to leave home, which is fantastic. And of course, as you mentioned, monetary donations too. You can again visit our website to donate. But we also have something really interesting going on right now, Teena, and it's called our Urgent Animal Care Fund. we launched this fund, well, it's getting about 3 weeks maybe or so ago. And this fund really came because of a need that we're seeing with COVID-19. You know, the fact that we aren't adopting out animals means that they are going to be in our care a little longer. Which means those costs are going to accrue a little bit. So that Urgent Animal Care Fund will help us with that, with the animals in our care. But as well, we're seeing something really unique right now. We're getting a lot of phone calls from community members right across Ontario that are asking for help with all sorts of needs, you know, whether it be resources that they need help with, perhaps food, you know, sometimes people now, you know, maybe who have lost their job and their animal needs veterinary care. You know, we had a really interesting story about an adorable cat named Blue. He had an injury that needed immediate surgery, and the owner was struggling to sort of figure out how to get that done. And we were able to step in and ensure that Blue had that necessary surgery and doing quite well now, which is great. So again, that Urgent Animal Care Fund is going to help us to address all of those needs. And we have had people say, if I need help, where do I go? Who do I call? You can call our line 310-SPCA. We have people there that will chat with you, hear whatever you've got going on, and see if we can't help you.
That's absolutely amazing. So if you are in the position to help in any way, shape, or form, please don't forget all of our furry friends, because they need our help as well. And including those families, you're absolutely right. There are so many people that have lost their jobs and are financially completely stressed, and there's a lot of anxiety. So we want to make sure that we can help them if we can. So with regards to calls that come in, for people who may have come across a stray animal, what are they to do with the animal, or what can they do to ensure that the animal stays safe?
Well, you know, of course, again, we mentioned it's spring, so there's going to be, you know, people may see baby bunnies out and about, baby raccoons, all sorts of things. And, you know, the first rule of thumb really is not to touch them, not to bother them. If you are concerned for their safety or their well-being, wherever maybe they're placed is actually not an ideal position, call your local animal control. In some cases, that is your SPCA. I believe in Orangeville, yes, you would call and if you're not sure, just call your SPCA and they can also just help direct you in the right place. But essentially what you want to do there is get in touch with your animal control, and then they'd be able to assess the situation. If they feel that the animals need to be picked up, moved, perhaps if it's injured, you know, again, whatever the situation may be, they can help you out with that. In terms of the wildlife, again, too, if you're, you know, we mentioned all these people out walking their dogs in the neighborhoods, you know, you don't want your dog getting tangled up with any wildlife either. So just be mindful when you're out walking, even if it's maybe bright and early in the morning, or of course, when that sun is setting. Those are some peak times. So just be mindful, be aware, ensure that your pet you know, is hopefully up to date on vaccines. Of course, at this time, you know, it's really, I know people don't want to be going out too much, but hopefully your pet is up to date with all their vaccines and they have everything that they need to be safe this spring season.
Well, I mean, it's something to consider too, because I'll actually say that I guess because people are more, pretty much indoors right now. And I know the nicer weather's coming and people are going to be outside a little bit more. But the wildlife is possibly creeping into different areas where they haven't come before. I'll say I was sitting on my couch looking out the window in broad daylight and I saw a skunk coming down the street. And I'm like, it's daylight. Yeah, you don't realize it, but you're absolutely right. When you're out walking your pets, you really do need to be aware and conscious of what's around you, because he just waddled down the entire street, went under a fence, and I was like, I was quite surprised. So and that you're seeing more. My husband said he's seeing a deer as he was driving down Highway 10, and you know they're coming out because we're in right now. So be very aware. So you were telling me a little bit about what you're doing on social media and what you have available for families while they're in their homes.
So you can, of course, check us out on social media. There's a couple of different pages you can check out. If you want to follow like our entire organization, we are at Ontario SPCA on Twitter, Facebook, and Instagram. And then, of course, you can also follow the Orangeville and District Animal Center as well. And then you can see some more localized content. But, you know, we know that folks are inside, as you mentioned. Kids are home from school. That's a big one for parents right now. You know, yes, they have a little bit of schoolwork to do, but I know that parents are always looking for something to give their children. We have a really great program called Animal Smart. And Animal Smart is an educational series. It is curriculum based and been approved by school boards. So it's really great content. And it's all about teaching kids to be compassionate towards animals. There's some really fun activities that are, going to keep your child engaged, keep them happy, but also maybe they'll learn a little something. So we're releasing some of that content through our social media channels. And as well, we've got some other really fun stuff coming down, teaching how to make enrichment toys for your pets with materials that you would already have at home, which is really fun. So that if you have a pet at home, you can make something for them and watch them play with it, take a little video if you want. Lots of fun stuff to keep families engaged, hopefully happy, laughing, and why not have some cute animal videos and photos to check out as well? So we're trying to post lots of that to keep everybody smiling.
Well, and in this time when people need comfort, when they're stressed and there's anxiety, your pets can be that source of relief and just happiness. They just bring joy. So if you do have them, please cherish them and have some fun with them while you're at home as well. Not just about the walks, it's all about the cuddles and the snuggles and all the other pets that aren't able to go out for a walk, for sure. So tell me, what are you doing yourself to stay sane in these crazy times?
You know what? I think part of what I do is I have a bit of variety in my days. In the beginning, it was kind of like, okay, you wake up, you don't really get dressed, maybe you brush your hair, you go, you start working from home, and it kind of becomes a little bit monotonous. So what I found is switching it up. Maybe I switch my workspaces every week. So I work in one room and then maybe I'll work in another, making sure that I do actually take breaks. We take lunch breaks when we're at work. Again, it's nice out, it's getting nice outside. So really making sure that I actually go, no, it's time to stop, take a break, go outside, and get some fresh air and just sort of, wake yourself back up a little bit. And then, of course, yes, lots of snuggle time with my cat, for sure.
That's absolutely wonderful. So just say, for instance, we see a stray dog running around or, an animal that looks at a place. It looks like it has a home and should be at home. Are we still to call the SPCA?
Yes, our animal control officers are essential workers during this time, and as are all bylaw officers in different municipalities. So, of course, we want to ensure the animal safety. We also want to ensure our communities and our residents' safety. So it is important that you don't approach the dog. It could be frightened. It doesn't maybe know you. So it's important that you call the right people. What they're able to do as well is scan for a microchip, see if the dog has identification in that form, or perhaps they're wearing a collar with tags. If your dog does not have a collar with tags, it's something you should really consider because it really can help make sure that we reunite you with your pet. But yes, absolutely. Give the right people a call, make sure we can get that dog back home safely.
Wonderful. Kelly, I want to thank you so much for joining us today and taking out the time to let us know what's happening. And thank you so much.
Really appreciate it. Thanks, Teena.
All of you take care, and we'll see you next time.